Good morning, good evening, good night. Welcome. It is fantastic. Thank you so much for your kind patience in waiting for me to join the stream. We're going to be joining with Mr. Lewis in a little while, Dr. Lewis, who's patiently waiting in the room for me. Thank you. Welcome back to Lana's Little Things with me, Dr. Lana, specialist gerontologist, talking all things on living agelessly, family caregiving, entrepreneurship, and just life itself. So feel free. We are having a few more gremlins in the system, but those of you who are here, we are going to be joined by, and I have to do it with. There's a few technical things here. So we'll be joined by Mr. Lewis, who everyone wanted um, back, and for very good reason, because he was absolutely astounding in our last chat when we had spoken about breast cancer. And this is the month not just of men's health, of diabetes care, but it's also family caregiving month. So we've got a pretty packed month. And so, what better way to start than from where we left off, which is with Mr. Lewis. So, I sure hope if you can hear me, please tap a like or a yes in the chat, and I we will go from there. So, again, we just want to do a quick into Miss Lewis is here. Want to join him in. Um, we will be we will be joining him, or he will be joining us shortly. You're going to hear some feedback because our life has just begun properly on. I'm going to just stop this feedback if you don't mind. Thank you so much for your patience. When it's not one thing, it's another. Mr. Lewis, if you can hear me, please drop a like, a yes. I think he's trying to come in, but this is how gremlins work. So hey. I'm going to just bear with me. We're gonna pause one more, and he has a link that he has to join in with me. There is a link that he has to use to join in with me by the telephone, but he's not getting past. Oh dear. Okay. Well. We are going to be talking about. I'm going to just start him off by an introduction, and then we will go from there. Because we've got to just figure this out. This worked out last week, and it will be working out this time. I promise you, ladies and gentlemen. All right. I'm sending him the link. And we shall see how that goes. Copy. And I'm sending it to him now. And we'll be going live together very soon. Don't worry. You know, the crazier it starts, the better. So if he's gonna join us into this live stream, that would absolutely make my day and be absolutely awesome. So if you can hear me, add. And if we say add and I see his face and we all see his face, We can just do a whoop whoop. I know you can hear me because there is feedback coming from my mobile phone, which means that there is sound coming. So if you can hear me, if you're still here, drop a like. Don't give up. We are here. And we are, I know we were waiting. I know you're waiting. Don't worry. It's connecting. These things happen. Just gotta go with it. He's on his way. He will soon be here. I promise you. So Mr. Lewis is top surgeon. Hello. But he also has a passion for diabetes. And unfortunately, in Barbados, we do know that we have a very high incidence of breast cancer, not just breast cancer, we also have a high incidence of amputations. And that's not really something that we want to talk about really. That's something that we are, hi Ian, it's still connecting you. I am sorry. That's something that we are working on, obviously, but it's also another thing that we don't want to be. We've become the, as I say, the amputation capital of the world. We used to be. I don't know if we still have that nomenclature now. Mr. Lewis will fit us in and join us in. But before it gets to that, the entire month of November is not just about um, it's not just about amputations, sickness, diabetes, men's health, that sort of men's illness, I should say, that kind of thing. It is also about men's overall holistic care. And when we have holistic care, that makes a difference. And that's another thing that Mr. Lewis is passionate about. So I'm going to just once again ask for your indulgence while I join him. And if we don't, we will restream. We will retry this. Don't worry, this will work. I have confidence that this will work. So if you see me looking side to side, I'm actually looking at my laptop waiting for Mr. Lewis to come in. And I'm also talking in order to get him here. Ian, is that you? I hear your voice out. Well, I think I might be hearing voices now. But I'm hearing your voice. I'm still not seeing your connection. I don't think our guest is seeing your connection either. We have already gone live. Um, so I will continue the conversation for a minute. Movember, GENTS for the mustaches, we are concentrating on prostate health, not just prostate health, but men's breast cancer. We talked about that for a while. So what I'm going to ask you to do is to, as long for the audience that is here, I'd like you please to put in your questions. Just let's just start with the questions. If you have any questions, who's here, start with your questions and place them, and we can start. We can talk as soon as we get some linkages. So one of the questions that persons had asked last time was, what about the male breast cancer? And I know that male breast cancer, yes, it is less than 1% statistically. But if you are the one person, then clearly you are, it's 100% for you. So what do you do then? How do you check? How do men actually look for breast cancer in themselves? It seems to be a lot easier when it's women and a lot more challenging when it's men. But you can just generally be in the shower, examine yourself, examine your your breast area. It's the same process as examining. You would imagine you start from your arm and you come around the chest. It's the same process. So for men as it is for women. If you do feel a lump, do not be alarmed. If you feel more than one lump, do not be alarmed. I'm going to refresh the page. If you feel more than one lump, do not be alarmed. What you do is you go to your doctor, you ask them to check, and the check for men is usually most commonly an ultrasound. Now, if that ultrasound is negative, or let's just say that ultrasound shows benign lesions, then what will happen is that you will be able to, if it shows a lesion that is suspicious, they then go to biopsy. If it shows a lesion that is benign, then it's usually watchful waiting. So that's where we go with men's breast health. Prostate health, we gotta say, we said it earlier, gents. um, we gotta do it. It's a test that has just got to be done. If you understand what I mean, just please bear with the doctors. We actually do have to examine your prostate, and that is a rectal exam, but it only comes around once a year, like most important events. So please do not be dismayed. Now, I am thinking that I am going to have to press pause here, set this a different way, and ask your patients in coming back in. We've only 11 minutes out. I want to go and come back in and restart. If that's okay with everyone, again, these things happen. I do apologize. I am the computer is just it is what it is. We can't blame the tools. So we will work with what we have. We will see you back in a few minutes. So please bear with us and join us back in a few minutes. Okay? But I will close this for now because it's not cooperating. When it's not cooperating, we say no. So I'll see you back in a few minutes. Thank you very much. We will close the chat. Hi, Ian. Cancel that, and I'm going to send another link. I'm going to just restart it from the phone. I don't know what's going on. I don't know why you can hear me, why you're stuck, why it's stuck, why things are happening, but these things happen, and people will just come back to it the next time because we're going to have a fantastic discussion. That's that. So cancel it out, come out to that listening area, and I am going to start the live once again from my what the hell? I'm gonna sign out. I'm gonna start once again from my phone, and then we're gonna go again.